Mr. Atkinson's stable, but we're going to need that surgical consult now.
There should be someone on their way.
Okay, cool. Thanks, Nick. How are the two passengers from his car?
Ms. Brunning has gone to radiology for a chest x-ray, but they're understaffed, so she might be a while. And Mr. Dixon, he is in room 5, being monitored for a concussion.
Okay, who's up next?
Cubicle 1, bike versus tree. I'll introduce you.
Morning, guys. What have we got?
Esther said you're taking leave.
Change of plan. Doesn't make sense with Harper at that conference.
Yeah, it was a bit sudden. We're getting a locum in, but there's been some kind of delay.
Oh, just as well I'm here then.
So Esther doesn't know that you're not taking leave?
I will sort that out. Just point me at a patient.
Next one through the doors is yours.
All right. What? I'm clean and sober and fit to work.
And Esther doesn't know you're here.
Not yet.
How do you want her to find out, Maddie? Through the grapevine?
Hello. We've decided to postpone Marty's leave, so here's all yours.
Great.
Where do you need me?
If you could check Mr. Atkinson in recess, we're just waiting to transfer him to Cube 3.
On to it.
Hey, you okay?
I'm fine. Excuse me.
What is happening with the info that I gave you?
What info?
Serious? Lynch Pharmaceuticals and the unsafe wellness show?
I forgot to tell you, I passed that on to our lawyers. Once they've had a look, they'll be able to advise us on next steps.
And how long is that going to take?
I don't know, Taho.
Well, have you followed up?
I haven't had the chance. Look, Monica's away until Thursday, and there's just been a lot going on.
Look, I get it, but this is urgent. Do you want me to chase it up? We just need to make it a priority, that's all.
I also have to prioritise the hospital, okay? I can't go around making accusations against a multi-billion-dollar company unless I know they're going to stand up.
They'll stand up. Believe me.
You have cellulitis, but luckily I think we've got to it in time. Some antibiotics should clear that right up. IV flucloxacillin. I'm charting it now.
You're still here then?
I am.
How did you change Esther's mind?
By promising no more's a question.
Right, and you can do that?
Yeah, of course.
Well, it's good that you see it that way, but you're going to need support.
I know that. That is why I'm asking.
What?
If I can stay. I'll be clean and sober, paying rent and board.
Marty, I've got Billy.
I know that. And I promise you, no drugs of any kind in your house or in my body.
You've heard about the new policy then?
What policy?
Hospital-wide drug testing.
From when?
Dunno.
Well, there you go then. Double insurance policy.
Okay, yep, you can stay on those terms. A recovering addict.
Thank you, Nick. Thank you so much.
Marty, can you give me a hand in recess, please?
Yeah. Nicole, it's Madonna. Hey, complaining of abdominal pain, temp 37.1, BP 140/110.
Are you still in pain?
Yes.
1 to 10?
9.
She refused pain relief.
I can't take any chances with my babies.
Any other symptoms?
I also fainted last night
What?
in the lockers, but I recovered.
Oh my God, Madonna.
Okay, Logan, room 2 is free. I'm going to call a doctor and get you a scan, okay?
Yeah, thank you.
Any dizziness?
I feel a little bit lightheaded.
What about spotting?
No, nothing.
Okay, well, that's a good sign.
See, that's good.
I'm just going to lift your top up and put the jelly on. Might be a bit cold.
Sure.
Everything's gonna be all right. You're so strong, and our babies will be too. We'll get through this.
I just want to hear their little heartbeats.
Sometimes it takes a minute. Okay, let me try that again.
What's going on? Why can't we hear them?
I can't seem to locate the heartbeats at this stage.
I knew it.
Hey, you know with the Doppler scan it's hard to hear, even with bigger babies.
No.
Sometimes we just need an ultrasound.
No.
Hey, try not to worry, okay? I'm going to get you settled into a ward. Find a sonographer and we'll get you a formal ultrasound, okay?
This can't be happening.
So if you have...
Just try to relax. The ultrasound will give us all the answers we need. Until then, there's no need to worry unnecessarily.
You got that?
Yes, I'm staying calm. God will hear my prayers.
That's right, he will. Hey, you want me to give you a shoulder massage for a bit? That always relaxes you?
I don't really feel like being touched right now.
Okay, that's fine. Really soon, we're going to find out that there was absolutely nothing to be worried about.
Maybe.
Definitely. It's all going to be okay.
If you don't stop saying that, I'm gonna lose my mind.
Okay. Okay, I'll stop.
I'm sorry, babe. I know you're just trying to stay positive.
Nicole's right. There's no point worrying until there's something to worry about.
Okay, Madonna, I'm going to get hold of the sonographer for you, okay?
Thank you.
And Chris isn't operating today, so I'll get in touch with him.
No, don't bother Dr. Warner.
I am doing it. You guys can't be waiting anymore. It's too rough.
Thanks, Nicole.
And you know the drill. If you've got any more pain, anything at all, we push that and I'll be there as fast as I can.
Hey, don't cry.
It just seems like nothing has gone to plan with this pregnancy. I mean, what if I cursed it?
What?
My attitude, not really wanting them.
No. No. Of course you want them. We both do. We love them.
I'm so scared.
I'm scared too.
Kim is the best. You'll have a result soon as.
What's happening?
Just give me a moment.
Can you still not hear heartbeats?
Am I miscarrying? Chris, what's happening? It's a miscarriage, isn't it?
No, it's not a miscarriage.
Then what?
There's no heartbeat because, I'm sorry, Madonna, you're not pregnant.
Well, that can't be right. The test was positive, multiple tests.
The scan shows a mass in your uterus. I'll need a biopsy to confirm, but given the fact it's triggered a positive result on a hormonal pregnancy test, I'm so sorry, it's most likely a tumor.
It's cancer.
We don't know that. It's most likely a fibroid, and they're not usually cancerous.
Oh, so I don't understand. So there's a tumor, and it's endangering the babies?
There are no babies.
It's overwhelming, I know.
I can't believe it. A tumor growing inside me, taking over my body.
Like I said, we'll do a biopsy.
To confirm it's cancer.
Hey, just look at me, hun. Hey, we're all here. And we're going to take good care of you. But right now, you just need to listen to Chris, okay?
So, the biopsy, I'll consult with Esther. Looking again at your elevated HCG levels, it's clear to see why we thought you tested positive for pregnancy.
So you're like 100% sure? There's no babies in there?
We're sure, Billy. Would you like to take a look at the monitor?
No?
Okay. Well, I think that sedation has taken effect.
Better have.
Hey, babe, you're doing great.
No, I'm not.
All right, just a slight painful sensation here, Madonna.
Just breathe through it, hun. Good work.
You're just amazing, Madonna, the perfect patient.
No, I'm not.
Just talk to me, yeah? Anything, everything. Come on.
All I can think about is how stupid I am.
No, stop saying that.
It's good. Just let it all out.
I bought a cot, Nicole. It was expensive. What a waste of money. I don't even know why I bought it. Just to try and make it real.
Tell me all about it.
From the moment Harper confirmed the pregnancy, I just knew something was off. But every day I fought against those instincts. I let Philly talk to the babies.
You didn't know?
All this time, talking, cuddling, caring for a tumor.
Oh, I'm so late.
I haven't even started yet.
Okay, you sure you're okay to be here?
Yeah.
You don't want me to make an excuse? It's busy any day.
Nick, you have to treat me like a normal colleague. No babysitting, no managing.
Okay, sorry.
Thanks for waiting, everyone.
Have the lawyers read their report yet?
It is on their to-do list.
It's urgent.
How was Madonna?
The biopsy's done, so we just have to wait for now.
Is she up for visitors?
just be aware that she's feeling vulnerable and a little bit silly.
We should still show our support. Whip round for flowers in a car.
I'll organise something.
Thank you. Now, I wanted to formally present the hospital's new drug testing policy to the co-op. I presume everyone's had a
I
chance.
vote no.
We're not voting yet, Drew.
I come here as an advocate for the HCAs. It's okay, Tim? I got you on this.
Really?
Now, most of them are young. They do not know how to manage their party lifestyle. And weed, I mean cannabis, can stay in your system for weeks. You're not even high.
Well, I think we have to look at the facts. Multiple break-ins, kids dealing morphine, fentanyl, cyclastine, and it's clear that this nation has a prescription drug abuse problem. And it's possible that it could be affecting some of our staff.
Sorry, Esther, I needed an ED.
Sure, go. Does anyone else have a problem with voting this through?
I would like clarification.
On?
Let's focus on alcohol, shall we? Now, I know people in this room who enjoy a drink after work, a glass of red, a cocktail or two, because they deserve it. Getting a bit close to the bone now, aren't I? Next, privacy breach. Now, only someone like Stalin himself would disregard privacy.
Hold on there, Drew.
Test for cocaine, meth, opioids, benzos, the big boys. But if the HCAs can't even have a joint in the weekend, well, we're not going to have any HCAs at all.
What if we take cannabis off the table?
Unless impairment is suspected.
Sounds fair to me.
Okay, Class A drugs only.
Second that. Third that. Let's vote.
All of those in favour. Thank you, everyone.
Timeline?
Testing will start, well, as soon as documentation and systems have been checked with legals and the board.
Good work, team. Common sense was the winner on the day.
You did the right thing.
Bailey's been playing this game.
It is chaos.
He makes a huge obstacle course out of everything he can find in the lounge and just races his car around and around.
Oh, cute.
I bet Kiwi would love it too.
Yeah, I bet he would.
I really miss you guys.
Same. Maybe this weekend.
Yes.
I haven't said anything.
Walk in the park, ice cream, whatever.
Let me think about it.
Sure, no pressure.
What's with this all-staff memo?
Which one?
The drug testing one.
You're going to act like you don't know after your Braveheart speech and on the HCAs.
I just thought the bureaucratic wheels would turn a lot slower. It's starting today.
Do we need another co-op meeting?
No, we do not need another meeting. You took up so much time.
Drew, I gave you you got to meet me halfway here.
Okay. I have reviewed and I approve the shifting goalposts.
Ah, it's called efficiency.
You're welcome.
Thank you so much. Maddie,
Yeah,
what's up with you?
I'm fine. Stroke patient in room 6. I think I missed something.
Okay, do you want me to double check
I'll
the
do it.
tests? You're in the 2 p.m. bracket for testing?
Yeah, I know.
And then he took.
What is wrong with ice cream in the park?
It might confuse the kids.
No,
Well, I'm meant to be doing tough love, but I just can't.
because you guys are the real deal. True love. Okay, come on, let me have it.
Off the record?
Of course.
I think that testing was a mistake.
Okay.
I should have sent him to rehab immediately.
But he's doing so well.
What if he fails a test?
That's not going to happen.
If he tests positive, I'm going to have to fire him.
Yeah?
Well, his job is the only thing holding him together. What is he going to do if he loses that?
Yes, you can't pile this pressure on yourself. I mean, you're CEO, you're the mother of 2 kids. That is enough.
Yeah, but what about Marty?
Look, he's living with me. We're having a great time. Just let me handle your husband. I'm so sorry. I'm so sorry. That was a little bit inappropriate.
I needed a laugh. Thank you.
Oh, anytime.
Anyway, back to Madonna.
Hey, you made choices for Marty's own good. Okay, and you're not in this alone. I'm here too. We can get him back on track. I know we can.
All right, nice and clear. I'll get that off to the lab for you.
Do you want me to take that for you?
Hey?
Well, Julia should be doing. Oh my God, you're not.
What?
You are not stealing urine samples.
Come on, that's a bit paranoid, don't you think?
Give me some credit.
Okay, Okay, I know this looks shady, but I have stopped sequestration completely, but I might have residual drugs in my system.
Listen to yourself. You are the definition of shady.
I am clean, but I might not pass this test.
So what, you think you can walk in there with someone else's urine?
I'll never work again, Nick.
Get used to the idea.
I'm a doctor. It's all I know how to do.
You cannot do this.
Nick, come on. You are the only person who knows what I'm going through here. You're my friend.
What are you asking me?
Esther still loves me.
You're
she does.
trashing that.
No, I love her more than anything. You know what we've been through. I can't lose her. Look, you know I'm clean, but I might not pass this test without your help. Please, Nick, I am begging you here. Nick?
You just give me some space to think.
One time, that is all. Just to get it out of my system. Give me a chance to get my family back.
Yeah, I know. You love them. I understand.
They are everything to me. If I lose them for good...
You know what you're asking me to do, right?
To help a friend. I would do the same for you.
But I would never ask you that.
Right, I'm sorry. I didn't...
No, just enough. Marty, don't.
Hey, Nick, listen, I'm sorry about before. I was freaking out. Have you had a chance to think about it?
I care about you, Marty, and I care about your staff. I hate to see what you guys are going through, but I don't think...
Okay, I get it. Yeah, I understand.
Anything else, Marty, okay? Just name it. I want to help, I do.
This is the only way.
Well, look, you might not even have sequestration in your system. I mean, when was the last time you took it?
A few days ago, before Esther kicked me out. But if even a trace of it shows up, I lose my family for good.
I know that it is tough.
Look, I love her. I love our kids.
We've been through this.
Look, I made a stupid mistake. Okay, the anxiety, everything with the shooting, I couldn't cope. Nick, please. Okay, I just wanted to feel normal again. You know? But look at me now. Maybe this is what I deserve.
Marty.
No, I'm despicable. Asking you to lie for me, Nick. I'm so sorry.
Joining me for the sanctioned privacy violation?
It is just around the corner, Drew. You're going to have to show the nurse that you've got nothing in your pockets and leave your sample in the store.
Will Big Brother be watching?
No one wants to see that.
Just checking.
We're heading there now.
Ridiculous, isn't it?
Thanks, Iona. I can take over.
Seriously, you're done already?
My lot. Anyway, we've still got the admin staff to go and the night shifts. But yeah, there were no spills, no hold-ups. Everyone was in and out like clockwork. So,
Nick, can you just tell me?
what?
Marty, did he pass?
Marty. Yeah. Yep. He passed. All clear.
Thank God.
Yeah. Oh.
Sorry.
No.
Nick, God, thank you.
For what?
You covered for me.
You knew you'd failed.
No. I was just worried. Did you?
Yes, I lied to Esther.
You did. Thank you so much.
I feel sick about it.
I'm sorry.
Don't waste this, Marty.
I won't.
I mean it. You get clean and you stay clean and you never ever end up here again.
You have given me a second chance. Esther's talking to me again. I have hope now. And that's all thanks to you.
Promise me, Marty.
Yeah, of course.
Because
I
if you
promise.
mess up again, I'm not going to bail you out. Do you understand that?
Absolutely. I'm not going to blow this. I know how lucky I am to have a friend like you.
Well, I'm Esther's friend too, and I do not like lying.
I know, and I am sorry, but you won't regret this. You saved me. You saved us. You'll see.
Just a quick update. All the results are in and everyone was clean, bar one HCA. You might want to check with them. Everyone was cooperative, even Drew.
Wonders never cease. Nick,
Yeah.
I just want to say I'm sorry for bringing up Marty and the testing if it made you feel uncomfortable.
No, you can talk to me anytime. You know that.
I was just worried.
Yeah.
But now that I know he wasn't lying, it's a good step forward.
I'm glad.
Me too. How was he?
He's trying. He's missing you guys a lot.
I wasn't exactly happy about him staying with you, but knowing that he's with a friend and that he's okay,
I love you both. You know that.
it means a lot. Having someone in our corner, well, the Marty and Esther working it out corner.
Yeah, I'm your biggest cheerleader, so try and stop me.
Thanks. Are you ready? Madonna's myectomy.
Sure am.
I'm just going to pop down chicken.
Great.
And for the record, I'm happy that you're on my team for that too.
I haven't seen a fibroid this big in a long time.
Okay, now we're getting somewhere.
Well, at least they can plan for a baby after this.
More suction, please. I can't see a thing. I'm just trying to get this fibroid off the uterine wall. It's really growing in there.
She's losing a lot of blood.
Diathermy, please. I need to get ahead of it.
BP's dropping.
Put up a unit of blood. Come on, Madonna.
Is enough?
What's her BP?
70/40.
I can't get the bleeding under control.
She's going into DIC.
I know, she needs platelets.
We might have to consider moving.
Not yet.
Listen, I don't want to either, but if it's a choice between a hysterectomy and her bleeding out,
Just 1 more minute.
her BP is falling. She's hemorrhaging.
We are not doing a hysterectomy. It's not what she wants.
We do not have a choice. We're losing her. Esther,
Hang on.
we don't have time. We have to move to a hysterectomy now.
Well, it's not what she wants. I can do this.
She's losing too much blood.
I'm nearly there.
I'm sure she'd rather live.
Can I get more swabs?
Madonna signed the consent. She knows what can happen.
I am honouring my patient's wishes.
She will understand.
Wow, is that what you thought when I was lying here?
The bleeding is increasing, okay? We need a decision fast.
Okay, well then we move quickly.
You are dicing with her life.
Madonna and Billy are going to start a family, all right? So can we put up another unit of blood, please, and line up the next one under the massive transfusion protocol?
Esther, you listen to me, please, okay?
Grasping forceps and get the emulsifier ready.
Forceps.
I need your full attention, Nicole.
Hello?
Nice and easy. More suction, please.
I'm trying.
Well, then can you get a swab in there? I can't see a thing. And I'm going to need a clamp ready in about 2 seconds. Just hang in there, Madonna. I've got you. And there it is. Okay, clamp. And suction. Let's get some sutures in here.
Clamp and suction. Let me know when you're ready for sutures.
How are we looking, team?
Okay, just.
Her BP's still low, 70/50.
Well, that will look better soon with the unit of blood and the fluids. Are those sutures ready?
Ready.
And tissue forceps.
Tissue forceps.
Gosh, isn't it crazy that we call these baseball stitches? Shouldn't we call them softball stitches instead? Like, we took a risk, okay, and it paid off.
Only by chance.
And skill and teamwork.
Could have gone the other way.
Well, it didn't.
Esther, you gambled with her
I
life.
saved her fertility and I honoured my patient's wishes. Now, can you get the other sutures ready, please? Because I've got at least 3 layers here. It's good. She's all good.
Oh, thank God.
We successfully removed the fibroid.
You'll be able to go see her in a minute.
Thank you, both of you.
It was a team effort.
You seem to be taking ages. Was everything all right?
Yes and no. The fibroid was adhered pretty deeply into the uterine wall, which meant we experienced some complicated bleeds.
Oh, no.
A lot of serious blood loss.
But Esther handled it. She went above and beyond.
I can't thank you enough.
The rest of her uterus looks healthy. I think the tissue will heal well, and I'm confident it won't impact Madonna's reproductive health. Not in the near future, at least.
What? Will she get more fibroids?
Well, the risk of getting more fibroids is high, unfortunately, with women who have already had it before, but with regular checkups, I'm confident that we'll be able to avoid getting any more big ones, hopefully. Look, she's got a good, clear fertility window for the next couple of years before anything has a chance to grow back too invasively. But like I said, with regular monitoring, you better keep on top of it all.
Great. Can I see her now?
Yeah, she's in recovery.
Thank you for standing by me.
Yeah, I still think that you made the wrong decision.
Nick.
Madonna's our friend, and you didn't want to let her down. What if we'd had to come out here and tell Billy that we lost her?
We didn't have to.
Yeah, but what if we did? Do you think he'd be thanking you for honouring her wishes?
You don't know what it's like, okay? Waking up and realising that no one's actually listened to you.
You've got to take the personal out of it, yes. Tough decisions need to be made. And we were lucky. It's the only reason why Madonna's still alive.
Hey, are you free at the moment? There's an apology muffin waiting for you in the cab.
I don't need an apology. I've thought about it a lot, and you did what you believed was right.
I'm just lucky that things worked out the way they did.
Yeah, no, that wasn't luck. That was skill.
Maybe. Madonna made me promise to let God work through me.
God, is that what it was?
Doesn't really feel like it, but maybe having him on her side made all the difference.
Well, whatever it was a good outcome.
I did speak to Marty about it.
Yeah, how was that?
It was hard, but good, being open and honest. I think we're just finding each other again,
Yeah, it's great.
Yeah. And he passes a couple more tests and we can talk about him coming home.
It's a bit early, isn't it? I mean, he's only passed one test.
Well, two. One when he started back, otherwise I'd never have let him work.
So the first test, he was clean.
Well, yeah, that's good, right? He's doing everything I've asked. No lies, no secrets, clean slate.
He didn't pass the drug test.
What?
The one I did, I lied for him.
Why?
He begged me, and he was scared that there'd be residuals of Clastin in his system, and he was so scared of losing you and the kids and his job. But if he passed the first test, then that meant that he took the Clastin before the second one. I'm so sorry. Yes, I'm so sorry. I believed him. He promised me that he was going to get clean, and he was passionate and convincing.
It's not your fault. He convinced me to.
No. I was sucked in, and I should know better. I mean, I've been around addicts. Cassie, Connor, and I know what they're like.
It's not you, it's him. Well, I'm taking tomorrow off and then we'll drive up and get settled in.
It's great you got to bed so quick.
Chris pulled some strings for the Phoenix Trust.
I'm sorry it came to this, Nick. And I'm so sorry I lied to you.
Thank you.
I know I've got a problem and I'm going to beat this.
Whatever it takes.
Whatever it takes.
I'd appreciate it if it wasn't public knowledge.
Yeah.
Just say he went away for professional development. Get a locum in Rahu and Harper can cover.
Got it.
No one needs any more detail.
I'm not trying to hide what I've done.
Well, even still, after everything, I think it's best if we keep things confidential.
You guys are doing the hard yards. Come here. We have faith in you, Marty. You've got this.
The locum is booked. Rahu has stepped up. Yep, all right. Well, wish Marty well from me. Okay, bye.
Hey, stranger.
I think Rahu's talking to you, Monique.
Hi. Hi.
Where were you last night?
Out.
Then you hid in your room.
So?
Since when do you wear glasses?
Just...
Also, do you know what's going on with Marty?
What is this, 20 questions day?
Oh, it's just you look so different.
Oh, Nick, we're up.
Thank you.
Kia ora.
No Esther today.
No, I got the memo.
And Marty's gone to,
Rehab, yeah.
very wise.
Yeah, I thought you might have known through the Phoenix Trust.
I made some recommendations. I'm glad they followed through. Oh, Monique.
Selena, Eddie Lynch was looking for you.
Oh, she was here.
No, she called. You were on your rounds.
She is so hard to communicate with. So, going through a whole wall of assistants.
Then one of them turned up and left you that. When does the screening program start?
Next week. Oh, I need to sort out my roster with you.
That's going to be a bit of a squeeze.
No, I can make it work.
I meant for me.
Oh, my God.
What?
That's bigger than I thought. I mean, how often does that happen? My bonus.
Right. Lynch Pharmaceuticals pays well.
Thank you, Jesus. Thank you, Beyonce. Thank you, all the angels. My pen, let me sign this.
Chris, I think someone is in the mood to celebrate.
Is that so?
Yeah, just my bonus I was talking about.
Right. Addie can obviously be generous when she needs to be.
Are you saying that this is blood money, like Rahu?
No, I never said that. I'm just glad that they've got someone onto it, like you, to run the thing.
Oh, okay. Thanks.
Don't mention it.
What is going on there?
1 minute we're on, and then suddenly we're off, and then... was that on? Are we on again?
What are you doing?
Supervising. Edge had a tricky one.
I don't need you babysitting.
Oh, I'm just here as backup if the infection is severe.
Well, I did a proper washout the first time.
I know.
It's not my fault he didn't do the correct post-op care.
Well, didn't say it was.
Whoa, okay.
How's it looking?
Well, the infection spread into the thenar space and the adductor pollicis.
Let's see.
Ooh.
Swab.
Please. We've got pus tracking dorsally around the adductor and in between his two heads.
Mm-hmm. That lumbriculus doesn't look too happy either.
Yeah.
How do you want to proceed?
Washout take 2, and then I'll assess from there. Can we prepare for irrigation, please?
Sure.
You know, I've been thinking...
About irrigation?
No, about my conference in Singapore. You should fly out at the end of the week, meet me there, and we could go on to China together. I've checked. Cover can be sorted for him.
What?
Visit Jalan and Shun.
Should I be thinking about this right now?
Of course not. Subject for a later time.
Ready to irrigate?
Right. Good. Let's get a good result. Is the numbness wearing off, Kerry? Can you feel this?
Yeah.
Good. Now, there will be a little tingling, but that'll wear off by morning.
Obs are all within normal range.
Great. Tracking well. Now, I just want to see how you're going movement-wise. Don't push it, but could you try and move your little finger, please? Nice. Now your ring finger. Middle?
Nothing.
It's all right. Just nice and gentle. Could you try your index finger, please?
I can't feel it.
It's okay. It's early days.
I'll keep trying.
No, just rest for now. It's pretty common, given you just had surgery. We'll wait for the swelling to go down and we'll try again.
Maybe tomorrow?
You got every chance.
Do you know something that I don't?
How did Mr. Guyforce go?
Fine.
It was actually a really difficult operation.
We got that.
The infection was so severe that I doubt he'll gain full movement in his hand.
Damn.
So why did you tell him differently?
Because it's early days, like I said. We'll wait for the swelling to go down and try again.
You gave him false hope.
I gave him some hope.
It wasn't the full picture.
Do you want to write up the surgical notes? Right. That's my job.
Hey, I've read Mr. Kane's notes. You said his mobility prognosis was...
Bleak. And if I were him, I'd want to know the truth. Not some maybe we'll see dreamland of Harry's.